The Ohio Health Information Partnership had the opportunity to talk with Dr. Ted Wymyslo, a family practitioner who now heads the Ohio Department of Health, about the concept of patient-centered medical homes. Learn how to improve patient care from this expert.
Okay.
So tell us a little bit, Dr. Wymyslo, about how electronic health records will assist with this concept of a patient-centered medical home.
Very good. Yeah, well, the patient-centered medical home is best achieved as a goal if you have electronics to support it. But electronics are not an absolute necessity, it's just harder to do it. But the patient-centered medical home is a method of coordinating care that's different than traditional practices that done. Typically in traditional practices, a patient, when they think they need to see you, would call, make an appointment, come in to see you, you'd get done whatever they came in for, try to add in some prevention and send them off until they next contacted you. In a patient-centered medical home, we're trying to be better at coordinating all their information, but all their needs, and do it from a central site, which would be typically a primary care office, but it could be mental health office, it could be other practitioners who are willing to be comprehensive in their scope. And what we're doing with the patient-centered medical home is focused a lot on coordinating decision-making when you're not in the doctor's office. Because usually between office visits, patients don't really have a lot of contact with their doctor's office unless they're calling for a refill or something of that nature. Well, what we want to do with the medical home model is help people know what they're due for, help them follow up on what they need on those times when they're not really needed to be in my office. And in fact, I can connect and talk and communicate with them either electronically, verbally, we can text, and make sure we're staying in touch with them throughout their year so that they're not seeing me once or twice a year. They're actually connecting with my practice multiple times, potentially a month, where they're getting advice from us, they're getting information from us, we're advising them on good decisions in their health, we're helping them know how to stay optimally well. And so that coordination that happens with the patient over time outside of my office, not in my office, that's what makes the patient-centered medical home somewhat unique. Well, that's facilitated if you have electronic connectedness on the one hand, but the other parts that you want to build in are enhanced access to patients. That means typically have other hours besides traditional hours so they can get to you not only with questions, but physically see you. So many of the medical homes will have evening hours, weekend hours, and they'll leave hours open during the day on their schedule so you can call in same day and get into the practice and see your doctor. Because a lot of stuff is unpredictable. So we want to make sure those patients can call in and say, I'm not sure, what should I do? And you're saying, gosh, usually I'd send them to an urgent care center, but I've got some openings in my schedule, bring them in here. Mm-hmm. Well, that's where we want to get people, is to someplace and someone who knows them well. Well, there's an assumption there that you've got a team typically that is going to care for patients also in the medical home. Now, I could do it myself, but it's going to take more time and effort. Well, it's a lot of time and effort if you're going to be comprehensive with a patient. So it's better if I have nursing staff and I've got receptionists, I've got people that work surround me, including social workers, dietitians. Many of these other people can complement what I'm able to give the patient, and they can get at areas that I don't have the time to get at, to be a total physician who takes care of the whole patient. So being comprehensive doesn't mean I have to do everything. It means I have to have staff that helps me to get everything done with the patient. So there's a difference between those two. That makes it doable for a doc who can't spend an hour with every patient. But we want to still get that information to everybody, so I share the workload with my team. Then part of that access enhancement we're looking for is using electronics so that people can connect with me if they need to when they're traveling electronically. They can go ahead and ask questions when it's convenient for them, not so much when it's convenient for me. Because my office schedule is all built around what's convenient for me in the past. Now what we're saying is, what does the patient need? Remember, we're staying patient-centered. And so the patient said, we'd like to be able to email you if we have a question instead of calling you. Okay, let's set it up. In many practices, they allow texting, especially for our younger population we care for. They'd much rather text. They don't even know how to talk.
They don't email anymore?
I don't think they text. So what the practices have to do is adopt and adjust. Because remember, our goal is to get at what the patient needs, not at what I need. So I want to get at what works for them and what's meaningful to them. And then hopefully I'll get at my goals that I have, which are my quality goals with my population. So the patient-centered medical home allows that to happen by putting other parameters for communication in place besides the traditional telephone capability that's in there. Looking at the whole need of the patient, this is that comprehensiveness that's part of one of the core principles of patient-centered medical home, so that when a patient comes to my office or calls my office or texts me or emails me, that what I'm looking at is the whole picture for them, not just the one thing that they're calling in about. So if they come in, they call in and say they have a headache, what I've got in front of me is the whole picture on them because I've done a comprehensive assessment. I know what medicines they're on, I know what their background is, I know where they work, I know what their family situation is, I know the community setting they're in, and that helps me better deal with whatever complaint they come to the fore with. On the other hand, I don't wait for complaints in a medical home. We're being proactive with this. So if I know it's been a year and say someone's due for a revisit and they haven't contacted us, that's where our registry helps us find those people and automatically contact them. So you get that benefit with your dog through your vet, you get it through your dentist, right, who lets you know these things. Well, why don't we do that with the whole rest of you, you know? If your pet's that important and your teeth are that important, I would think the whole rest of your body has an equal level of importance. And that's what we're trying to do with our registries in our medical home settings, is make sure we're letting people know when they should realistically be contacting, connecting, or being updated with us about what they're due for. Even if you're perfectly healthy, I want to make sure that you know what a perfectly healthy person does at this point in their life so they maintain very good health, and hopefully we'll have a population that ages more gracefully and is optimally functioning at the highest level you can. See, our focus is a lot on quality of life, not just your longevity, but how good is the life that you have and what do you need at any particular point in time. So we're just taking into account human nature and how it usually works and putting in place corrective mechanisms that touch base in predictable ways in people's lives, so much is not left to chance.
Currently, hundreds of Ohio physicians and offices have transformed their practices into patient-centered medical homes. To find additional information about these homes, go to any of these websites: www.ohioafp.org, www.pcpcc.net, and www.transform.com. To learn more about the Ohio Health Information Partnership, electronic health records, and the statewide information exchange CliniSync, go to www.clinisync.org. Thank you to Dr. Wymyslo of the Ohio Department of Health for his insights. To learn more about the Health Department, go to www.odh.ohio.gov.